The adductor pollicis. It originates from the capitate bone in the second and third metacarpal, and then inserts on the ulnar side of the proximal phalanx of the thumb. This muscle is innervated by the ulnar nerve and it allows adduction of the thumb. To test this muscle, we put pressure on the medial surface of the thumb, pressing into abduction.
Hold on, let me move you. Dorsal interossei. The origin of the first lateral head is the proximal 1/2 of the ulnar border of the first metacarpal bone. The first of the medial head is the radial border of the second metacarpal. The second, third, and fourth are the adjacent sides of the metacarpal bones in each inner space. The insertions of the first is the radial side of the index finger, the second is the radial side of the middle finger, the third is the ulnar side of the middle finger, and the fourth is the ulnar side of the ring finger. Its actions are to abduct the index finger, middle finger, ring fingers from the axial lines of the third digits. It assists in flexions of the metacarpophalangeal joints and extension of the interphalangeal joints of the same fingers. The nerve that innervates them is the ulnar nerve. To manual muscle test, you would slightly put the wrist into extension. Same with the fingers. You would then hold both sides and have them adduct.
Don't let me move you. Don't let me move you.
For this section, we'll be manual muscle testing extensor pollicis longus and the extensor pollicis brevis. The extensor pollicis longus originates middle 1/3 of the posterior surface of the ulna. It inserts at the base of the distal phalanx of the dorsal surface of the thumb. Its action is to extend the interphalangeal joints, and its innervation is radial nerves C6, 7, and 8. The extensor pollicis brevis originates from the posterior surface of the body of the radius distal to the interosseous membrane. It originates at the base of the proximal phalanx of the thumb's dorsal surface. Its action is to extend the metacarpal joint of the thumb and also extends and abducts the carpal metacarpals. It innervates C6, 7, and 8. Now to test the extensor pollicis longus, apply pressure to the dorsal surface of the interphalangeal joints of the thumb.
Don't let me move you. Don't let me move you.
To test the extensor pollicis brevis, apply pressure against the dorsal surface of the proximal phalanx in the direction of flexion.
Don't let me move you. Don't let me move you.
Extensor carpi radialis longus. The origin is the distal 1/3 of the lateral supracondylar ridge of the humerus. The insertion is the dorsal surface of the base of the second metacarpal bone on the radial side. The action is the extend and abduct of the wrist. The nerve is the radial nerve. To manual muscle test this, you would put the wrist into extension, grab by the second metacarpal base, and try to put them into flexion.
Hold, don't let me move you. Hold, don't let me move you.
The extensor carpi radialis brevis. The origin is the common extensor tendon from the lateral epicondyle of the humerus. The insertion is the dorsal surface of the base of the third metacarpal bone. The action is to extend and assist in abduction of the wrist. The nerve is the radial nerve. To manual muscle test this, you would put the wrist into extension, hold down by the base of the third metacarpal, and try to put them into flexion.
Hold, don't let me move you. Hold, don't let me move you.
Extensor digitoria. The origin is the common extensor tendon of the lateral epicondyle of the humerus and deep antebrachial fascia. Inserted by 4 tendons, each penetrating the membranous expansion of the dorsum of the second through the 5th digits and dividing over the proximal phalanx into the medial and 2 lateral bands. The action is to extend the metacarpophalangeal joints and in conjunction with the lumbricals and interossei extends the interphalangeal joints of the 2nd through 5th digits. The nerve that innervates is the radial nerve. To manual muscle test this muscle, you would hold the wrist, put the fingers into extension, hold right above the MCP joints, and don't let them move you.
Hold, don't let me move you. Hold, don't let me move you.
Flexor carpi radialis. The origin is the common flexor tendon of the medial epicondyle of the humerus and deep antebrachial fascia. The insertion is the base of the second metacarpal bone, and the action is to flex and abduct the wrist. The nerve that innervates is the median nerve. To manual muscle test this, you would put the wrist into flexion, go to the radial side, with a few fingers and try to put them into extension.
Hold, don't let me move you. Hold, don't let me move you.
The flexor carpi ulmus has two origins. The humeral head, which is the common flexor tendon from the medial epicondyle of the humerus. The second one is the ulnar head, the medial margin of the olecranon and proximal 2/3 of the posterior border of the ulnar. The insertion is the pisiform bone and the ligaments of the halmate and fifth metacarpal bones. The action is the flexing and adducting of the wrist. The nerve that innervates them is the ulnar nerve. To manual muscle test this, you would put the wrist into a flexion, then hold on to the ulnar side and try to put them into extension.
Hold, don't let me move you. Hold, don't let me move you.
For the flexor digitorum superficialis, it originates in the common flexor tendon from the medial epicondyle of the humerus, medial side of the coronoid process of the ulnar head, and the oblique line of the radius on the radial head. It's inserted by the four tendons into the sides of the middle phalanges of the second through the fifth digits. It's innervated by the medial nerve and is responsible for flexing the proximal interphalangeal joints of the second through fifth digits and flexion of the wrist. To test this muscle, you will block the MCP joints and pull the middle phalanx into extension.
Don't let me move you. Don't let me move you.
For the flexor digitorum profundus, it originates in the anterior and medial surfaces of the proximal 3/4 of the ulna. It's inserted by four tendons into the base of the distal phalanges on the anterior surface. This muscle is innervated by the medial and ulnar nerve and is responsible for flexing the distal interphalangeal joints of the fingers. To test this muscle,
Don't let
you
me
will
move you.
block the MCP and PIP joints and pull the distal phalanx into extension.
For this portion, we'll be testing the flexor pollicis longus and the flexor pollicis brevis. The flexor pollicis longus originates from the medial epicondyle of the humerus, the anterior surface of the radius, and the interosseous membrane. It then inserts onto the palmar surface of the distal phalanx of the thumb. This muscle is innervated by the median nerve and primarily flexes the IP joint of the thumb. The flexor pollicis brevis originates from the flexor retinaculum, the trapezium bone, the trapezoid, and capitate bones. It then inserts onto the base of the proximal phalanx on the radial side of the thumb. This muscle is innervated by the ulnar and median nerve. To test the flexor pollicis longus, we press on the palmar surface of the distal phalanx of the thumb, moving in the direction of extension.
Hold, don't let me move you.
To test the flexor pollicis brevis, we apply pressure to the palmar surface of the proximal phalanx and have the patient resist motion.
Hold, don't let me move you.
Lumbricals. Origin of the lumbricals is the radial surface of the flexor profundus tendons of the index and middle fingers, respectively. Adjacent sides of the flexor profundus tendons of the middle and ring finger. Adjacent sides of the flexor profundus tendons of the ring and little fingers. Its insertion is the radial border of the extensor expansion of the dorsum and respected digits. Its action is to extend the interphalangeal joints and simultaneously flex the metacarpal phalangeal joints of the second through fifth digits. The nerves that innervate it of the first and second fingers are the median, the third and fourth fingers are the ulnar. To manual muscle test this one, you would put your hand into supine position, grab onto a piece of paper, and
Don't let me pull it. Let me pull the paper. Don't let me pull it.
The opponent's pollicis. This muscle originates from the flexor retinaculum and the tubercle of the trapezium bone. It then inserts on the entire length of the first metacarpal bone on the radial side. This muscle is innervated by the median nerve, and it allows for the thumb to oppose the palm. To test this muscle, we apply pressure to the palmar side of the metacarpal of the thumb, bringing the patient into semi-opposition and having them resist.
Hold, don't let me move you.
For the opponent's digiti minimi, we recognize that the muscle originates from the hook of the hamate bone in the flexor retinaculum and then inserts on the entire length of the fifth metacarpal bone on the ulnar side. This muscle is innervated by the ulnar nerve and allows the small finger to oppose the palm. To test this muscle, we place the hand in a supine position with the little finger opposing the palm, and we apply pressure to the base of the fifth metacarpal.
Don't let me move you. Palmaris longus. The origin is the common flexor tendon of the medial epicondyle of the humerus and the deep antebrachial fascia. The insertion is the flexor retinaculum and the palmar aponeurosis. The action is the tense of the palmar fascia, flexes the wrist, and may assist in flexion of the elbow. The nerve that innervates is the median nerve. To manual muscle test this, you would have the wrist into slight flexion, and you would pull both sides of the radial and ulnar side
Don't let me
into
move you.
extension.
Don't let me move you.
Palmar interossei. The origin of the first is the base of the first metacarpal bone on the ulnar side. The second is the length of the second metacarpal bone on the ulnar side. The third is the length of the fourth metacarpal bone on the radial side. And the fourth is the length of the fifth metacarpal bone on the radial side. Insertions of the first is the ulnar side of the thumb. The second is the ulnar side of the index finger. The third is the radial side of the ring finger. And the fourth is the radial side of the little finger. The action is to adduct the thumb, index finger, ring finger, and little finger towards the axial line through the third digit. The nerve that innervates them is the ulnar nerve. To manual muscle test, you would have in slight extension, have the fingers opened up, and ask the patient not to let your fingers go as they try to go into adduction.
Keep your fingers straight. Don't let me move my hand. Don't let me move.
The abductor pollicis brevis. This muscle originates from the flexor retinaculum and the tubercles of the trapezium and scaphoid bones. The muscle then inserts on the base of the proximal phalanx of the thumb on the radial side. This muscle is innervated by the median nerve and allows for abduction of the thumb. To test this muscle, we put the hand into a thumb neutral position, applying pressure to the radial side of the proximal phalanx and have the patient resist.
Don't let me move you.
The deltoid is functionally organized into three portions: the anterior, the middle, and the posterior. The fibers of the anterior deltoid originate from the anterior border and superior surface and lateral 1/3 of the clavicle. The middle fibers originate from the lateral margin and superior surface of the acromion, and the posterior fibers from the inferior lip and posterior border of the spine of the scapula. All three portions insert on the deltoid tuberosity of the humerus, and this muscle is innervated by the axillary nerve. These muscles primarily allow for abduction, but the anterior portions allow for flexion of the shoulder and the posterior for extension as well. To test this muscle, we'll bring the elbow to 90 degrees flexion and slightly abduct. To test the anterior portion, we'll apply pressure to the anterior lateral portion of the humerus and have the patient resist.
Hold, don't let me move you. Hold, don't let me move you. Relax.
To test the medial deltoid, we'll apply pressure to the lateral aspect of the humerus and have the patient resist pressure.
Hold, don't let me move you. Hold, don't let me move you. Relax.
To test the posterior deltoid, we'll apply pressure to the posterior lateral portion of the humerus and have the patient resist pressure.
Hold, don't let me move you. Hold, don't let me move you. Relax. Good.
Introducing the coracobrachialis. This muscle originates from the coracoid process of the scapula and inserts on the medial surface of the shaft of the humerus opposite the deltoid tuberosity. This muscle allows for flexion and adduction of the shoulder joint and is innervated by the musculocutaneous nerve. To test this joint, we bring the shoulder into slight flexion and flex at the elbow, and we resist the motion of the patient wanting to pull inward and upward.
Hold, don't let me move you. Hold, don't let me move you. Good. Supinator. The supinator originates from the lateral epicondyle of the humerus and it inserts at the lateral surface of the 1/3 of the body of the radius. Its action is to supinate the forearm. Its innervation is radial C5, 6, and 7. To test the supinator, while supporting the elbow, supinate the forearm. At the lower forearm above the wrist, avoid twisting in the direction of pronation.
Hold, don't let me move you. Hold, don't let me move you.
Radialis. Its origin is a proximal 2/3 of the lateral supracondylar ridge of the humerus. It inserts on the lateral side of the base of the styloid process of the radius. The action of the brachioradialis is flexes the elbow joint, and assists in pronating and supinating the forearm when these movements are resisted. It innervates at radial C5 and 6. To test the brachioradialis, support the elbow and resist against extension.
Hold, don't let me move you.
Biceps brachii, short and long head. The origin of the short head is the apex of the coracoid process of the scapula. The origin of the long head is a supraglenoid tubercle of the scapula. Its insertion is a tuberosity of the radius and aponeurosis of the bicep brachii. Its action is to flex the shoulder, and short head assists with shoulder abduction. Its nerve innervation is musculotaneous C5 and C6. To test the bicep, elbow must flex slightly less than the right angle with the forearm in supination. Then apply pressure against the forearm in the direction of extension.
Hold, don't let me move you. Good.
Similar to with the short head is going to be at a 90-degree angle.
Hold, don't let me move you. Good. The infraspinatus. This muscle originates from the infraspinous fossa of the scapula and inserts on the middle facet of the greater tubercle of the humerus. This allows for external rotation and is innervated by the suprascapular nerve. To test this muscle, we place the patient's arm at 90 degrees and about 10 degrees abducted. Then we'll try to force the patient into internal rotation and have them resist.
Hold, don't let me move you. The latissimus dorsi. The origin is the inferior angle of the scapula, the spinous process of the last 6 thoracic vertebrae, the last 3 or 4 ribs, and the posterior iliac crest. It inserts at the intertrabecular groove of the humerus. It innervates at the thoracodorsal nerve. Its action is to extend the shoulder, adduct the shoulder, and medially rotate the shoulder. And to test this muscle, you're going to extend the shoulder and the elbow as you push down into flexion on the forearm. Hold and let me move you.
Levator scapula. The origin is the transverse process of C1 through C4. The insertion is the medial border of the scapula between the superior angle and the root of the scapular spine. The innervation is the dorsal scapular nerve. The action is elevation of the scapula and downward rotation of the scapula. To manual muscle test this, you would have the patient retract his scapula back, elevate them, then you would push down onto the superior angle of the scapula.
Hold and let me move you.
Pronator teres. This muscle has 2 different origins. The origin of the humeral head is immediately above the medial epicondyle of the humerus, common flexor tendon, and deep antebrachial fascia. The origin of the ulnar head is medial side of the coronoid process of the ulna. Its insertion is the middle of the lateral surface of the radius, and its action is to pronate the forearm and assist in flexion of the elbow joint. Its innervation is median C6 and 7. To test the pronator teres, pronate the forearm while the elbow is supported. At the lower forearm above the wrist, avoid twisting in the direction of supinating the forearm.
Hold, don't let me move you. Hold, don't let me move you.
Rhomboids. The origin is the spinous process of C7 through T5. The insertion is the medial border of the scapula from the root of the scapular spine to the inferior angle of the scapula. The innervation is the dorsal scapular nerve. The action is to retract the scapula, elevate the scapula, and downward rotate the scapula. To manual muscle test this, you will have the patient laying in the prone position. He will then retract his scapula, extend his arm with his palm down, and the clinician will then press down on his forearm.
Hold and let me move you.
Serratus anterior. The origin is the outer surface of the superior border of the upper 8 or 9 ribs. The insertion is the costal surface of the medial border of the scapula. The action is the abduction of the scapula, the protraction of the scapula, the upward rotation of the scapula, and it also prevents winging of the scapula. The nerve is the long thoracic nerve. To manual muscle test this muscle, you would have the patient reach up with a fist as high as he can to the sky. You would then support by the wrist and push down and try to retract that scapula.
Hold, don't let me move you. Good job. The subscapularis. This muscle originates from the subscapular fossa of the scapula and inserts on the lesser tubercle of the humerus. This muscle is innervated by the upper and lower subscapular nerves and medially rotates the humerus and the glenoid. To test this muscle, we place the patient's arm at 90 degrees elbow flexion and apply pressure to the palmar side of the wrist. We apply pressure and force them to resist external rotation.
Hold to let me move you.
Supraspinatus. This muscle originates from the supraspinatus fossa and inserts on the greater tubercle of the humerus. This muscle allows for shoulder abduction and is innervated by the suprascapular nerve. To test this muscle, we place the elbow joint at 90 degrees and apply pressure to the lateral epicondyle of the humerus and have them resist.
Hold, don't let me move you. Hold, don't let me move you.
The teres minor. This muscle originates from the dorsal surfaces of the lateral border of the scapula and inserts on the lower facet of the greater tubercle of the humerus. This allows for lateral rotation at the shoulder joint and stabilization of the humerus and the glenoid cavity. It is innervated by the axillary nerve, and to test it, we place the elbow at 90 degrees, abduct it about 30 degrees, and we resist internal rotation.
Hold to let me move you.
Teres major. This muscle originates from the dorsal surfaces of the inferior angle and lateral border of the scapula, and it inserts on the crest of the lesser tubercle of the humerus. This muscle allows for medial rotation, adduction, and shoulder extension. It is innervated by the lower subscapular nerve. To test this muscle, we place the patient prone, have them bring their arm into internal rotation, hand behind their back, and we apply pressure to the medial side of the elbow.
Hold, don't let me move you. Hold, don't let me move you. Relax.
The upper trap. The origin is the external occipital protuberance. The distal attachment or the insertion is the posterior superior aspect of the lateral 1/3 of the clavicle. The innervation is the spinal accessory nerve, and the actions are elevation of the scapula, upward rotation of the scapula. To manual muscle test this, the patient would shrug up his one shoulder as high as he could, and the clinician would push down trying to resist elevation of the scapula.
Hold, don't let me move you.
The middle trap's origin is the notch of the spinous process of C7 through T5. The insertion is the medial aspect of the chromium. The innervation is the spinal accessory nerve. To manual muscle test this, the patient would extend its arm out to the side. The clinician would then try to pull it into retraction of the scapula as they try to resist it.
Hold, don't let me move you. Good job, relax.
The lower trap's origin is the spinous process of the middle and lower thoracic vertebrae T6 through 12. The insertion is the upper lip of the spine of the scapula near the medial border. The innervation is the spinal accessory nerve. The actions are to depress, upward rotate, and retract the scapula. To manual muscle test, the patient would put his arm up in extension. The clinician then would try to stop from depression of the scapula, upward rotation, and retraction of the scapula.
Hold, don't let me move you. Good job, relax.
Triceps brachii, long head and short head. The origin of the long head is from the infraglenoid tubercle of the scapula. The origin of the short head is approximal 1/2 of the body of the humerus. Its insertion is the posterior surface of the olecranon process of the ulna and antebrachial fascia. The action is to extend the elbow joint. Its innervation is the radial C6, 7, 8, and T1. To test the long head and short head, have the elbow supported at mid-range and forced into flexion.
Hold, don't let me move you.
Pectoralis minor, the origin, superior margins, outer surfaces of the 3rd, 4th, and 5th ribs near the cartilages and fascia over corresponding intercostal muscles. Insertion, medial border, superior surface of the coracoid process of the scapula. Action, with the origin fixed, tilts the scapula anteriorly. The nerve, medial pectoral. And to manually test for the pec minor, the patient is supine on the table with pillow under neck with slight protraction, elevation of the shoulder. Clinician pushes down with the heel of their hand on the coracoid process, moving the scapular into retraction.
Hold, don't let me move you. Hold, don't let me move you. Relax, good.
The pec major, origin, medial half of clavicle, sternum, and cartilage of 1st through 6th rib. Insertion, the crest of greater tubercle of humerus. The action, adduct the shoulder, medially rotate the shoulder, assist to elevate the thorax during forced inhalation. Flexes the shoulder, horizontally adducts, extends the shoulder. The nerve, lateral pectoral C5 through 7, lateral and medial pectoral C6 through T1. To manually test the pec major, the patient will start with elbow extended, and clinician will put pressure against the forearm in the direction of horizontal abduction.
Hold, don't let me move you. Hold, don't let me move you. Relax. Good.
This is PTA 291.
Straight
I want to keep testing this muscle. Now listen to me, Kelly. I want you to test this like it was your own hand, Kelly.